ER. I do cover some clinic hours, but mainly the ER, and in the past I've worked mainly just family practice. Love cardiology, so heart disease is kind of one of my favorite things to talk about. So we'll talk about heart disease in women because February is Go Red month for women. We tend to be more undiagnosed than men as far as heart disease goes, so we'll talk about that. So we're going to start with statistics. Every 90 seconds in the United States, a woman suffers a heart attack. So every minute and a half, one of us could suffer a heart attack. More women have died from heart disease than all cancers combined. Think about that. All cancers combined, more people die from heart attacks. More females die from heart attacks. Okay. While 1 in 31 American women die from breast cancer each year, 1 in 3 dies of heart disease. So 30% of us. It's a lot. In women, coronary artery disease usually develops 7 to 10 years later in life compared with men. I think that's changing though, because in society, women are tending to work more, so they have a lot more stress. And that used to be kind of why we weren't having heart attacks or developing heart disease as early as men, because we weren't in those stressful positions. But now that we're working and it's usually a dual income family, those numbers are starting to change. Diabetes is the strongest risk factor in women. In fact, this study suggests that diabetes triples our risk for developing heart disease. In men, it doubles the risk. 9 out of 10 women have at least one risk factor for heart disease or stroke, and we'll talk about risk factors later on in the talk. And then since 1984, more women than men have died each year from heart disease, and the gap between men and women's survival continues to widen. So that's one of the things that the American Heart Association developed Go Red for Women for, was because women tend to be underdiagnosed when they come in with symptoms of a heart attack. Most women have atypical symptoms when they come in, so just kind of want to teach you guys what those symptoms could be. It's not usually the normal crushing type chest pain, so we'll talk about that. We'll talk about risk factors, and we'll talk about self-care and kind of ways to help ourselves maybe not develop some of those risk factors. Okay, so heart disease is kind of a general term, and there's 4 different heart diseases: coronary artery disease, heart failure, arrhythmias, and heart valve problems. The one that we're going to talk about today is the top one, the coronary artery disease, which atherosclerosis is something I don't know if have you guys heard about or not, but usually, let's see if I can get this thing to work. I'm not going to. And it's on. Okay. So usually, this is what our arteries look like. Nice and clean and clear, blood can flow through there really well. And then all of a sudden something happens. Usually high blood pressure creates a little tear in the artery wall. So then what happens is white blood cells and our inflammatory process come into that area and like drop down little platelets and kind of try to create an area where there's a little bitty clot there. And then with high cholesterol, we tend to develop cholesterol that packs on to that little area that started as a little tear. You know, kind of like on your floors when you're walking, if there's a little bitty bump, you're going to hit your toe every time and stop right there. That's kind of what happens to the cholesterol. Everything starts to pack in. Kind of narrows that down really well. And then sometimes what happens is, as we develop diabetes, high blood pressure, if we smoke, we can create little bitty microclots, and then those can actually block that artery. Now, you don't have to have a blood clot. It can actually be just that you have enough cholesterol plaquing to kind of close down that artery. So that's the part that we're talking about today, okay? So risk factors, smoking. This is usually one of the number 1 risk factors between men and women together. Smoking, because of the nicotine, it actually causes constriction of your arteries. So if you can imagine that slide before, narrowing, you smoking some nicotine and it constricts those down even more. It's making that area even more narrow for blood to be able to get through there to your heart, okay? High blood pressure, cholesterol, and diabetes definitely are risk factors. And again, like we said earlier, diabetes triples females' ability to get coronary artery disease. So diabetes is one that we really need to focus on as females. Not exercising or sitting for long periods of time. Of course, I am, the ideal person to talk about that because I don't exercise. I should. We all know what we're supposed to do, but we tend not to do it, and that's kind of where that self-care comes in. Eating a diet high in salt, saturated fats, cholesterol, and added sugars. Sugar is one of the biggest ones, actually. We used to say cholesterol, bring cholesterol down, don't eat such high cholesterol foods. There's a lot of mixed reports on that actually now, and sugar is tending to be the one that they're really focusing on because sugar actually increases all the inflammation in our body. So it starts causing more aching, can actually lead to more kind of narrowing of those arteries. So sugar is really the bigger one that we're pushing towards now. Drinking, this one really kills me. Drinking 2 or more diet sodas a day in women 50 and older. I'm 50. I drink a lot of Diet Coke. So this is one that I'm going to have to kind of work on. But these are new studies that actually have just come out. And younger than 50, they still are trying to encourage you to not drink more than 1 artificially sweetened beverage a day.
So what's why?
The aspartame in there, they're saying that actually it causes some changes in the body that actually can lead to more narrowing of the arteries, can lead to stroke. So that's kind of a new campaign, Diet Stroke versus Diet Coke. So, yeah.
So our little sweeteners. What about our little sweeteners, artificial sweeteners?
The only artificial sweetener that I know of that is considered okay is stevia. Yeah, it comes from a natural plant, has no side effects at all, but pretty much Splenda, Sweet and Low, Equal, all of those are not good. I know. So like Crystal Light, the Gatorades that are zero, Gatorade Zero, Power Zero, a lot of those have those artificial sweeteners in there. And if you think about, we're feeding them to our kids too, because we're trying to keep their sugar levels down. But if you're going to drink something, drink the regular. It's just the sugar's better for you than the artificial sugar.
So real sugar is better than fake sugar.
Yeah.
So Dr. Pepper and not Diet Coke.
Right.
Yeah.
Regular Dr. Pepper.
Yeah. But still, then you've got to start thinking too, okay, it's got a lot of sugar in it and a lot of sodium. So you got to look at that too. But ideally, So being overweight or obese definitely increases your risk factor for heart disease. Family history of early heart disease. So this is really important. You want to know your family history. If your parents, one of them had heart disease or had a heart attack, especially prior to age 50, that puts you at an increased risk for heart disease. Older age, of course, the older we get, the more we've eaten, the more we've been stressed. So it just kind of builds on itself. Diabetes, mental stress, depression, obesity, and smoking tend to play a bigger role in the development of coronary artery disease in women compared with men. So, risk factors specific to women. Menopause. So once you've gone through menopause, that's going to increase your risk. 1, because of your age alone. 2, because we have decreased estrogen levels. Estrogen tends to be cardioprotective, so it's heart protective. It's also bone protective. But after menopause, taking estrogen in tends to also increase your risk for cancers. So there's that fine line you've got to kind of walk there with that. And that's why a lot of times they've come up with newer medications to help with bone health and all those other things. But exercise, especially weight-bearing exercise, is going to help kind of get your bones stronger, so you're not going to have to worry about taking estrogen. But being in menopause can definitely increase your risk factor for having coronary artery disease. If you started menstruating before age 10 or after age 17, again, because of the estrogen play. Gestational hypertension or preeclampsia, mainly because that increases your risk for becoming hypertensive later or having high blood pressure later in life too. Gestational diabetes during any pregnancy, again, because if you have gestational diabetes, that's going to increase your risk factor for having diabetes as you get older. Preterm delivery, I'm not really sure what this is for as far as why that might possibly cause increased risk, but that's definitely on the list. So, polycystic ovarian syndrome, hormones are at play again in that as well. Plus PCOS patients tend to have more of a metabolic syndrome, which is where they tend to be a little bit more rounder in the waist, and that type of body tends to have increased estrogen and increased risk for high blood pressure, that kind of thing. So those are risk factors specific to women. Symptoms of a heart attack. So women can have the classic symptoms: crushing, squeezing, pressure, chest pain, radiating into the jaw, radiating down the arms. Usually the left arm is what we hear the most. or what's portrayed the most on television. But women can also come in and not have those symptoms. They can come in and be cool as a cucumber and say, you know, I just don't feel good. My back kind of hurts a little bit. I just don't feel good. I don't feel like I have the energy to get up to do anything. Those are symptoms for heart attack for a female. So you have to be really careful and kind of just be wary and know your risk factors for heart disease. My mom had a heart attack 1.5 years ago on my birthday, which was a great birthday present. But she actually, the only symptom that she had was she was anxious. My dad called and said, you know, she just can't sit still. She goes, I don't know, she's not hurting, she's not, I'm like, I would go ahead and go into the hospital. So they went in and sure enough, she was having a heart attack and they did a cardiac cath and she had 99% occlusion of the widowmaker, the LAD. So if she hadn't gone in, and she kept telling my dad, I'm fine, it's probably just the day, I'm just, you know, and luckily he knew to call and take her in. So otherwise she probably would have died at home because they live out in the country, so getting an ambulance out there would have taken a little bit. But uncomfortable pressure, squeezing, fullness, kind of like I talked about. Center of the chest lasts more than a few minutes, comes and goes. So it's not, you know, some people come in, they're like, you know, I've got this chest pain, it's been there for 3 days. More than likely, probably not heart. 1% chance it could be, but more than likely not heart. Pain or discomfort in one or both of the arms, the back, the neck, jaw, or stomach. Again, these are pretty typical symptoms for heart disease and for heart attack. So you can have these, but again, women present atypically. So anything up in here that's kind of achy, not feeling right, you got risk factors for heart disease, definitely something to come in and be checked out for. Shortness of breath with or without chest discomfort. So some people come in and they're like just feeling short of breath. They don't have chest discomfort, they don't have the chest squeezing, they don't have back pain. It's just, I'm just short of breath. And that could be kind of building over the time. So, and that was one thing with my mom. My dad had actually been in the hospital 3 weeks prior to her heart attack. And I remember walking into the hospital with her and she was just kind of huffing and puffing. And I'm like, are you okay? She's like, yeah. I'm like, how long has this been going on? Oh, it's been going on for a while. She's like, it's nothing. So I didn't really think about it at the time because we were dealing with my dad. And then when he called and said she was having that, I'm like, okay. So when I told her later, I'm like, you know, Mom, shortness of breath. That was your precursor. That was telling you something was not right. So, and of course she is obese. She has diabetes. She has high blood pressure. So she has all of the risk factors. So doesn't smoke. That was the only thing that she didn't do. So.
Yet.
Yeah, she may. 75, but I don't know, you know. Other signs such as breaking out in a cold sweat, nausea, or lightheadedness. This is a cute little video, and I hope it works. It worked at home, so. Oh, that's what I wondered. Sorry, guys. Wonder if there's volume on this thing. Oh, and there isn't that I can see. I apologize. It's really a cute thing. Elizabeth Banks is a comedian, and she had some family members that actually had heart disease. And so she created this little 3-minute video of her kind of, you know, women tend to not be very good about self-care and taking care of ourselves. We take care of everybody else. So this video is really good about showing, you know, she gets up in the morning, she's a lawyer, and she's taking care of everybody. You've got it on your phone. And she's taking care of everybody, and she's trying to get breakfast done, trying to get the kids out the door for the carpool, and she's making their sandwiches, and she starts kind of doing this thing, you know, and the son is, I don't know, probably about 10 years old, and he's like, Mom, are you okay? And she's like, I'm fine, just get that stuff done. You know, and she's telling him everything to do, trying to get, and the husband comes through, and she's made him his perfect breakfast type thing, and, oh, thank you, honey, are you okay? Yeah, I'm fine. You know, and then she starts doing her jaw again and kind of doing that, and then all of a sudden she lifts some plates, turns around, and drops the plates on the floor, and she's like, nobody move. And then she turns around to get the dustpan and runs into the wall. And the son's like, I think you're having a heart attack. And he pulls up the signs of the heart attack on the phone and hands it to her, and she's like, you better get to the carpool. And so he goes out to the carpool, and she's reading the signs, and she's like, so she calls 911. And she's telling me about her symptoms. Like, okay, I'm assuming they're saying we'll be there in just a few seconds. She's like, you can be here how soon? And she starts looking at her house. And she's like, can you make it 10 minutes? So is that not how women are? I mean, you know. So it's cute, and I'll put that on my Instagram page. I'll put that up on there so that you guys can look at it. It's really, really cute. So I apologize, I wasn't thinking about the volume. I'm not sure how to get that done. All right, so that was all the bad news. So the good news is 80% of heart disease can be prevented through lifestyle changes, or what I like to call self-care. So things that we can do for ourselves to help ourselves not develop heart disease. Even if you already have heart disease, following a healthy lifestyle will prolong your life. And there's actually new studies out that talk about that. And I'll talk about that on the next slide. I like this little cartoon. He had chest pains, a real wake-up call to slow down a bit. Unfortunately, he was on the other line and missed it. So when I saw that, I'm like, that's me. So we gotta slow down and take time for ourselves. So lifestyle changes, self-care, stop smoking. There are many ways to stop smoking. So I don't know if any of you guys smoke, but there are patches, there's medications, there's the 1-800-QUIT, Help Quit phone line that you can dial up, and they can go through ways of helping you to quit. They can get you in contact with somebody if you need to, for as far as like counseling. There's definitely stages of change that we go through as far as being ready for change, not being ready for change. What do we need to do to be able to get ready for change? So there's resources out there. Manage your blood sugar. Again, sugar is the #1 cause of increasing inflammatory changes in our body. So decreasing our sugar intake would be very beneficial. Getting your blood pressure under control. Again, if you manage your blood sugar, if you are diabetic and you manage your blood sugar, that's going to help your blood pressure control. Exercising is going to help your blood pressure control. Lowering your cholesterol. So there's all different ways. Of course, there's medications out there to lower your cholesterol as well, but just eating healthy, eating more fruits and vegetables, lean cuts of meat, that's usually the best way to lower your cholesterol, and then exercise. I've had patients who their cholesterol is, actually their total cholesterol is a little bit high, but their HDL, their good cholesterol, is so high that I'm not really worried about it. So the main way to increase your good cholesterol is to exercise. Know your family history. Again, like we talked about, early disease, heart disease, anything less than 50 is considered early heart disease. So if that is something in your family, then know that you're actually at a higher risk for developing heart disease yourself. Staying active. The guidelines for that is 150 minutes per week of moderately exertional exercise. Of course, if you've not been exercising for a while, don't go out and try to do like a run or something. Start slow and work up. Just do 5 or 10 minutes or walk. And just slowly start building up. But 20 to 30 minutes a day, and it doesn't have to be all at one time. It can be 10 minutes in the morning, 10 minutes at lunch, 10 minutes after supper. We'll just go out and take a walk, just up and do something. And this actually increases your chances, decreases your chances of developing dementia as well. So it's kind of a bonus thing to be able to go out and do that. Lose or manage your weight, which if you do all the things above that, that's going to help. Eat healthy, eat more plant-based and less processed foods. Most processed foods are going to have sugar in them. If they say they're sugar-free, then they actually have increased fat in them usually, and usually a sweetener in them as well. So, you know, we went through the whole realm of doing sugar-free cookies, sugar-free candies, all of that, but those tend to have more sugar alcohols in them, which, yes, they don't get absorbed, but they actually can cause diarrhea. I know when those first came out, I was like, this is awesome. And I ate like a whole box of sugar-free cookies and was in the bathroom for the rest of the day because of the sugar alcohols in there. So there's definitely some side effects to those as well. So just eating healthy and portion control, everything in moderation. Reduce stress. So this is one that I think probably women have the hardest time doing because we feel like we need to be everything to everybody. And since we're not just working in the home anymore, we're actually out and working in jobs, then we have to be more to more people. So learning to say no, that's my first thing, is you have to learn how to say no to people. And it doesn't have to be a bad thing. It's not a bad thing to not do something. So learning to say no to people. The other way that you can reduce stress is warm baths. I'm not a bath person, but most people who take baths say that it's awesome as far as stress relieving. So warm baths would be great. Getting enough sleep, which is the next one, that's actually going to help your stress too. So 7 to 9 hours a night. How many people get 7 to 9 hours a night? Kind of?
With the baby.
Even with the baby, that's
He
good.
wakes up like once.
That's good. That's good. That's awesome. Yeah. But ideally, that's what we need to be able to say that we're getting enough sleep is 7 to 9 hours. The other way that I reduce stress is by using essential oils because it helps kind of just relax my brain down. And I brought some stuff for people to help with sleep and to help with stress. So the ones on the right are to help with sleep in that little pack over there, and those have lavender and cedarwood in them. The ones on the left is the blend that I love and I usually carry around with me for emotional support, and it has Valor, white angelica, and orange in it. And you just can roll it on your wrists, smell it. You can roll it on the hands, rub your hands together, smell it in. But that's what I do when I start feeling like I'm getting kind of anxious about something. Then that's just kind of rub it in there and doing 3 big deep breaths like that, and usually I can just feel myself starting to calm down a little bit. And then the sleep stuff, I roll here and behind my ears before I go to bed, and that seems to help with sleep. You can roll it on the bottom of your feet as well. So anybody else have some ideas to reduce stress? Anything they do that they feel helps?
I like breathing techniques usually.
That's
the 4-4-7.
Yep.
Or it's at 4, right? 4 seconds breathing in, 4 seconds pause, 7 seconds breathing out, 4-second pause. I think that's a good way to concentrate on abdominal breathing.
Yep. Perfect.
It's a good way to
Definitely. Yep. And definitely expiration needs to be longer than the inspiration. So breathing out longer than you're taking your breath in, because that's how calms things down. Breathing in actually kind of hypes you up. So breathing out is kind of how that slows things down a little bit. So anybody else?
Play with the puppies.
Play with puppies, definitely. Animals, huge. I mean, there's studies out there that show it just brings that heart rate and brings the blood pressure down. It's awesome. So.
Don't watch cars before going to bed.
Yeah. Very good.
Right, that's right. That's right, yes. That's the other thing too with sleep is, we're kind of attached to our phones and our tablets and our televisions and our computers, and the blue light in here, actually, if you do it within 2 hours of going to sleep, it's going to decrease your ability to sleep. So there's actually glasses out there that block the blue light that you can get. They have magnification in them. They have 0 magnification in them if you don't need any of that. Actually just bought a pair for Frank and I to try and see if that would help a little bit because I'm bad about not putting my phone down before going to bed. But that's one way to kind of help increase your sleep too, is to get rid of that and maybe just read an actual book. That way you're not getting that blue light. Limit alcohol intake to 1 drink a day or less. So for females, we actually have to drink less than men as far as the amount. Ours is 2 ounces, men can have 4 ounces. So that's something that we kind of need to think about too. Limit artificially sweetened beverages to less than 1 per day is the recommendation. And like I said, 2 or more per day for a woman over 50, and that definitely increases your heart disease risk. This is the healthy lifestyle study I was talking about. It was in the British Medical Journal, and it showed that following a healthy lifestyle can actually extend the years of your life, that you're disease-free, but also it went into if you already have disease, like if you have heart disease, high blood pressure, if you're diabetic, even if you would start eating appropriately and getting rid of these 5 habits, you actually can extend your life as well. So if you're healthy, and you eliminate these 5 habits, so don't smoke, if you start exercising, which it will decrease your weight, if you don't drink too much alcohol, if you eat a healthy diet, then you can actually gain 10 years of disease-free living compared to women who don't adopt those 5 things. If adopted at age 50, women live 14 years longer than those who didn't adopt those, which is huge. I mean, that's a lot of years, really, when you think about it. Men can gain almost 8 years. And if adopted at the age 50, then they lived 12 years longer than those who did not. So, and then this one hit home for me because it's kind of like we're committing suicide if we continue to do all those things that we're not supposed to do. Unbelievable. Smoking a cigarette while shoveling snow. Did he leave a note? So, and that's all I have actually on slides. So does anybody have any questions? Comments about heart disease? Yeah.
What if your parents didn't have, heart attacks or something? But on my dad's side, they all died of heart attacks, except my dad.
Yeah. How old were they?
Oh, I don't remember.
Not sure, yeah. They're saying it's the early heart disease, so anything that's before age 50. So heart attacks before the age of 50 that really increase your risk for heart disease. So after 50, we don't really worry about it as much as being a risk factor. So, yeah. Like my sister actually had a heart attack when she was, let's see, she's 48 right now. So she was 42 when she had her heart attack. So that kind of increases my risk for heart disease. So, so that just kind of looking at your family history and seeing kind of where things are. Also diabetes, if they have diabetes, then you could be at higher risk for diabetes. And again, that's triples our risk for heart disease by three times. So really it kind of comes back to, and it's funny because every disease process comes back to those few things. Don't smoke, eat right, exercise, reduce our stress, get good sleep. So if we could do those things, we would probably bypass a lot of the disease processes that are out there, including cancer. So, because heart disease is really only 20% of it's hereditary. The rest of it is up to us.
I have a couple questions.
Yeah.
Somebody wants to know where you can get the decreased blue light glasses.
Yeah.
Where you
On Instagram, there's, and you could probably I'm sure you could probably go to the website. It's Cabbis, Cabbis, is where I got mine. I'm sure there's plenty of others out there too. I don't know. Does anybody else have blue light glasses?
These are.
Okay, where did you get yours?
I buy direct and Zinni Optical online will both allow blue light.
Okay. So I'm sure you could probably just Google, blue light reflecting glasses.
Prescription glasses.
Yeah.
And also info on buying oils, like trying these out.
Yeah. They can get a hold of me directly, and I can get them some samples if they want. Yep, definitely. Yeah. Any other questions, or did you have anything you wanted to add about heart disease?
I personally like to recommend nutritionfacts.org through my practice a lot.
Okay.
And they have quite a good resources of some of the diet and stuff that you can do. There's a pretty good study showing, if I remember right, about 15 millimeters per mercury decrease in systolic blood pressure and 9 in diastolic just from incorporating ground flaxseed in, I think it's 30 grams every day. Just by incorporating something like that can lower it that much.
Okay.
It's one of the things they recommend from studies there.
Right. Which, to me, nutrition, if we can adjust our nutrition, and I know this is something I need to do too, so don't feel like I'm up here kind of trying to tell you what to do, because I know that I need it as well. If we can adjust, I just think if we can adjust our nutrition so that we don't have to take medication, that's huge. Because everything that we do in medicine has a side effect. So every medication we give you is going to have a side effect. So if we can do nutrition, that's huge. So nutritionfacts.org. Okay. All right. So I think that would be great to look at that. I'll definitely go look at that too. So, and ground flaxseed actually, if I remember right, it helps with thyroid as well.
I'm not so sure on that, but it's a good source of omega-3 ALA,
Yep.
which helps in younger people can convert it to the more essential forms, and so
Yeah. Okay.
it's good.
Okay.
And fiber.
Fiber, definitely. Yep. Fruits and vegetables, meat, lean cuts of meat if you can. So, I know there's a lot of diets out there right now. Keto, paleo, there's just all different kinds. So I don't think one is anyone that we can really truly stay on for life, because our body truly needs all the different types of foods out there that are good for us. So yeah. Any other questions, comments?
You mentioned prepared foods,
Yeah.
like pre-cooked, frozen, so all you have to do is throw them in the microwave.
Still not good usually.
That's not good?
No. Most of the freezer foods, the TV tray foods that I used to have, how I call them, those have a lot of sodium in them. They are trying, I think, more now. I've not looked at the ones that are out now, but I think they are trying to decrease the amount of sodium in them. And they're trying to get more actual whole foods in there without so many additives. But I've not looked at the boxes to be able to tell you for sure what would be good and what would not be good. But yeah.
Does the packaging tell what's in there? I mean, can you...
It does, yeah, it does. Usually the nutrition labels, and that might be something that we might want to talk about at some point too, is reading nutrition labels and being able to figure out, you know, is this a good food for me to eat or not? But most of the ones that are prepackaged, now like flash frozen vegetables, you know, if you can buy fresh first, that's awesome. But of course it's hard, especially where we live. It's hard to get that in the wintertime. So frozen's always better, and then can is usually the least as far as choices that I like, that I usually recommend for people. So fresh, frozen, and then can. And then just trying to stick with things that either you make from scratch, or, which is hard, especially if you don't cook.
Sure.
But yeah, I mean, a lot of those delivery, like HelloFresh or Blue Apron, they tend to send, and I've not done it myself, so I can't speak specifically, but from what I've been told from other people, they send fresh ingredients to your house so that you don't have to go out and shop for them, which I love that fact. But they bring it in, but you still have to cook it. So really, ideally, anything that we can cook from scratch ourselves, from raw food, is going to be the best for us. Anything packaged is going to have preservatives. So, yeah, and usually a little bit of sugar in there. You know, it's weird. Shredded cheese. Usually they add a little bit of like a powder, like a flour to it, so that it doesn't cake together. So if you're trying to stay away from flour or gluten or anything like that, that's going to be in shredded cheese. So it's just, you really just have to read your labels and make sure that you're not getting something that you really don't want to get. So, does that answer your question?
Oh, kind of.
Yeah, well, it answers it, but it
It's a lot
doesn't
easier to
help.
throw it in the microwave.
Believe
and-
me.
Yeah.
Ask my husband. If I lived by myself, I'd probably be doing peanut butter and jelly sandwiches, and yeah.
So I should stop eating Tyson's chicken wings then?
Are they pre-barbecued?
Yeah.
Okay, yeah. I mean, ideally, yes.
Well,
Like I said, ideally. It's hard, but I think you just have to make the best choices that you can as you go along. So, yeah.
I do think some of those frozen healthy choice ones, I don't know if you've seen them in the grocery store, they just got them. And you could actually see the real big vegetables in there and protein and.
That's
and
what
they're
I wondered.
frozen.
Okay.
I haven't looked at the label, but.
Yeah, I haven't
they do
either.
look healthier.
That's because I saw an advertisement for Eating Well, the Eating Well frozen foods. And those look like they have like the big vegetables and actual just meat, but I don't know. I've not looked at the actual ingredients to see. I'm sure in order to freeze it and make it last the shelf life, there's probably preservatives in there. So it's just, you know, we're never going to be able to be totally good on our food, but if we can pick and choose and try to do better, that's probably where we're at. So, Tracy, do you have a question?
Oh, I was just going to say, I brought some information down over here just that talks about how depression is related to people with heart disease, and so there's a handout over here that somebody's interested.
Perfect.
And if they wanted more information or knew somebody that they felt like might be dealing with that in that aspect, I'd be glad to answer their questions.
Yep, definitely. Getting your cholesterol levels from your doc, kind of seeing where you're at, try to get those in line. You know, total cholesterol, we like to see less than 200. HDL, if we can see that above 40, that's usually best. That one, of course, one of the only ways I know to increase the HDL is by exercise. So do you have a different viewpoint on that?
I think from the studies I looked at, one of the studies showed that when they were doing the ultrasound, around 60 is when you have about no plaque. So for LDL,
Okay.
LDL
Okay. Yep,
specifically.
LDL, yeah.
So most people about on 100 still have some, and so in order to get that down, it's going to depend somewhat on genetics and then a lot on how much fiber to help take that out of your food. So.
Right. Yep, definitely. Yeah, LDL, they really want us to try to push lower than 100. So, yeah. Anything else, guys? Okay. All All right, that's all I got then. Take some samples back there. So like I said, the ones on the right are for sleep support, and the ones on the left are for emotional support. I use it for anxiety and just kind of, if I'm up all night, it kind of has a little bit of an uplifting scent to it as well. So helps me when I'm sleeping.
Where did you get your necklace so that you can carry it?
I got that on, it's off Instagram, and Gypsy Fox is her store, the Gypsy Fox. But yeah, it's a roller bottle, so then I can actually just pop this off and put my oils in there. And that's usually what I take with me is I have Valor, White Angelica, and Orange in this one all the time. So, and then if I don't have this on, so like sometimes when I'm on call, it's not appropriate to be having this dangling out. So I usually then have my bottles in my coat pocket. And that's what I bring with me, so yeah. But she's got all different kinds, so they're kind of fun. Yeah. All right, thank you guys very much for coming. So, appreciate it.